Big talking point today. India has now reported over 1,000 active COVID cases. India reported a rapid spike in new COVID-19 cases just in the last few days, with the spike in infections taking the country's overall case loads to over 1,000. Kerala, Maharashtra, Delhi were the states that saw the most number of new infections in the last 1 week. The Union Health Secretary reviewed the recent COVID-19 cases, noting most cases are mild and can be managed at home. The Union Health Secretary has urged people to not worry and need not wear, but instead wear masks in crowded places and get tested if they have any symptoms of COVID. So is COVID back again, or is this simply a mild strain? Joining us now are very special guests who were part, remember, of our COVID coverage that we did for a couple of years. Joining me is Dr. Swaminathan. He's the head of infectious diseases at Gleneagles Hospital in Chennai. And joining me here in the studio is an old friend, Dr. Hemant Thakkar, one of Mumbai's leading physicians. I appreciate both of you joining us because I want you all to take the FAQs that we are getting on COVID. Is it back is the big question, and that's what I want to ask. The first big question, Dr. Swaminathan, what is this latest variant of coronavirus, and is it really back, and should we be worried?
The question is not, is it back? The question is, has it ever gone away? The answer is no. It's always been around. It's just that there is a new variant of something where we have had a long list of variants. Just one more new kid on the block. It's slightly immunologically different from the pre-existing strain. So we are seeing a spike in the number of infections. That is to be anticipated. It's now become almost like a seasonal event like the influenza virus. It's still not got to that level. And therefore, it will keep going round and round like one of those lost Sputnik rockets. And it's just something we have to learn to live with. That doesn't mean it's going to create a nightmare scenario or anything that is causing panic. I think what we need to understand is that these kind of problems will happen. We will weather this. It's not going to be a major storm.
Dr. Thakkar, are you getting a lot of cases of people coming with flu with a mild variant of coronavirus? And is it in any way something to worry about, to panic about?
So after Enter the Dragon, we have phase 2, Return of the Dragon. But this dragon has lost its teeth and lost its energy. We're seeing lots of flu-like symptoms where patients come with cough and cold, but it's the extreme fatigue that brings in, is this the new COVID variant? So we are seeing a lot of patients with this, but it's short, and in effect, the patients almost completely recover, except for the ones with chronic diseases.
Mm-hmm. You know, it's interesting that you're saying that in most cases people recover, because I think what was the worry, Dr. Thakkar, with the previous variants, of course, was the fact that it pushed a lot of people into fatalities. You're saying in this instance, it's a mild strain. Am I correct?
Absolutely. You must remember that 56% of our population is vaccinated. 70% have had one vaccine. So in addition to the fact that the variant is mild, it's also facing the steely wall of vaccination, and your old vaccination is seen to work immunologically.
That's the next question I want to raise. Immunity from past infections and vaccine enough. If I was vaccinated to two doses, is that enough, Dr. Swaminathan? Or do you believe that
Absolutely.
Whether it is Covishield, is that enough?
Absolutely. See, let's make this very clear. If the Omicron had hit us before the Delta, we would have had as much carnage, if not more. But we learned from Delta, we learned from the vaccine, and we learned from hybrid immunity, so much so that Delta, the Omicron variant, was, an interesting statistical phenomenon, and epidemiologically we learned a lot. But clinically speaking, it didn't really make much of a difference for most people. And I believe the same thing is going to happen with the JN1 variant as well, and all future variants to come, at least for the conceivable future, unless, something new happens. And therefore, our immune system has been educated well enough And therefore, I think at this point, there is nothing really for us to get too excited about.
The reason, of course, Dr. Swami, that the people are getting excited about is the fact that cases have crossed 1,000. But you're saying it could be like any other influenza, which will come year after year and probably get milder by the year. Am I correct?
Absolutely. See, I have been on your channel for quite a long time, as you've noted in the past as well. And I've had this nasty habit of making predictions. And I stand by my conviction that this is also something that will come to pass. See, please understand that the immunological response to it seems to be pretty robust. And like Dr. Thakkar pointed out very clearly, most people are having a very mild, but yes, uncomfortable illness, no doubt. The concern is going to be primarily of those who are extremely debilitated and whether they will be able to weather the storm. I think we don't have enough data about that, and they need a little bit of monitoring. But for the vast majority of us, this is just going to be something which is a passing cloud, which may give us a little bit of a beating, but not necessarily something that's going to cause us significant damage either in the short or the long run.
But what we are getting, Dr. Thakkar, is a number of cases in recent weeks of people with flu. Now, is that again seasonal? The fact is monsoons are here in Mumbai. Are we, in all the people who are coming to you, are you getting those with clear COVID symptoms, or is it just a regular flu in most instances?
There is so much of overlap between the flu symptoms and the COVID symptoms. This time, because in erstwhile times when our immunities were low, the COVID symptoms had breathlessness, ground glassing, air hunger, saturation drops. So now with this admix of the seasonal flu with the monsoon flu and the resurgence of COVID, it's all an overlap and mixed. But I'm again emphasizing what Dr. Swaminathan also said. We will weather the storm, but that doesn't mean we take it lightly, because this virus has a bark which is bigger than its bite. The numbers are going up, so it is barking all over the place. So do not forget all the restrictions and care that we took. May not be that severely, but you have to mask in public places. Try and be hygienic. And if you do that, you will protect the seniors at home and the immunocompromised who are likely to get scarred even with the mild virus.
No, so are you saying social distancing only for those who develop the symptoms? I mean, should I be wearing a mask now out in the open today?
Like you and me are sitting less than 3 feet away, still we are not wearing masks. I would say if you're in the house or in the office, if you are asymptomatic, you don't need the mask. But if you want to see a film, see it at home. If you want to go to a crowded place, postpone it till the monsoon washes the virus away. Be a little more careful when indulging in public places and allow this seasonal COVID or upsurge in COVID to gently pass away without leaving a big ditch in the dump.
Dr. Swaminathan, more specifically, a question that is asked, how is this NB.1, 0.8, 0.1 different from earlier variants? You mentioned Omicron, Delta. What exactly is this new virus is a question being asked.
See, RNA viruses are inherently very incompetent at replication, and they make lots of errors. In a way, it's a survival advantage which allows them to keep evolving. Flu virus has been doing this for millennia. And that's why we keep getting hit by a flu season every year. And last year's vaccine is not a great fit. And Omicron is also an RNA respiratory virus, which is also having the same problem of poor replicator fidelity. And therefore, these kind of mutations will happen. Remember, millions of mutations happen, but except one, the rest of it is going to fall off because they don't give it any advantage. It has to have a survival advantage in terms of replicability and transmissibility. This one has a little bit of an edge over the pre-existing variant. That's why it's moving forward. But let us not confuse the transmissibility for the capability to produce severe infection or unusual infection. See, that's the cornerstone of the variant of interest and variant of concern distinction that WHO makes. They've called it a variant of interest because it's transmitting
don't-
faster,
and I
it's
don't
causing
need-
infection.
And I don't need another vaccine, am I correct?
I
Another
don't know if the
vaccine
vaccine
dose,
is going
do
to.
I need it?
I don't know if the vaccine is going to provide a significant game changer in this setting. See, I would probably consider the vaccine for my extremely elderly, vulnerable, like my stem cell transplant and things like that. But even there, I would say it's a caveat saying I may consider it. Mass vaccination at this point is unlikely to change anything. One, the wave is already here. So trying to get a vaccination campaign done at this point makes no sense. Two, we already have hybrid immunity, like has been pointed out. So I don't see a big value. And three, look at the data from about what's happening in the rest of the world. Really, nothing much is happening. Four, I'm coming to you from Singapore. The whole day I've been traveling around in Singapore, and I can tell you nobody is wearing a mask. Nobody is worrying about all of this. And the Singapore government has been conspicuously silent about it because they don't want any unnecessary panic. I'm not saying we should be running around willy-nilly spreading the virus. But the opposite should not be that, we go into hibernation and call it quits and say, let's get ready for a lockdown. I think some kind of middle ground is good. Like Dr. Thakkar said, take your own safety in your own hands. If you're a person with poor immunity, stay home, wear a mask, don't get into unnecessary trouble at this point of time. I don't know if the vaccine is a game changer. I am not for it. We don't have any new vaccines. Remember that. All the vaccines are the old vaccines. So whether it will be a great fit for the current strain, not likely. Whether it will give you any additional clicks out of it, unlikely. What would help is probably better availability of antivirals, especially for those who are symptomatic, to get them better faster, to reduce the risk of long COVID, and also for those who are vulnerable, who may have the risk of progression to severe disease.
So therefore, in conclusion, Doctor, am I right? A, don't panic. B, if you develop the symptoms, take all the necessary precautions, particularly if you're in vulnerable groups like the elderly. But for now, am I right in saying, and this is my final FAQ, is COVID simply just like another flu? We should treat it just like another flu without sort of harking back to what happened a couple of years ago and panicking about it.
Don't leave the shadow behind. For the simple reason, don't take it lightly. This virus can anytime come back and give you trouble if you allow it to. So if you allow it to live by and you allow it to die on its own, you'll be okay. But you have to have the precautions. If you have tested positive, stay away for 2 days. Don't go into crowded offices. And look after the elderly people and keep them isolated from you. Don't take any flu lightly. Leave alone this COVID flu because it is still the adjective COVID attached to it.
But don't change the way your lifestyle. We don't have to necessarily change your lifestyle in terms of the manner in which we had to do a few years ago, because the very word COVID brings in words like social distancing, lockdowns, stay at home. You're saying you don't have to change your lifestyle anymore.
Live normally, live carefully.
Live normally, live carefully is the message here from Dr. Thakkar. And I think that is the general message that Dr. Swaminathan also gave. And I think, therefore, that maybe for once we can hope that the worst certainly is over. The C word need not always lead to the P word, i.e. panic. Dr. Swaminathan, Dr. Thakkar, for joining me here today. Thank you very much.